Well, hey guys, David here, and I just wanted to make this video because there's something that I need to talk about. Um, Anybody who watches my videos knows that I'm a nurse. That my wife, she's a nurse, and that we are actually travel nurses. We're from Texas originally, but we're in New Mexico working at the Veterans Home for the state. So, the thing that I want to talk about is nursing is always considered the number one most trusted profession. And people really, look up to nurses and respect, being a nurse. And I'm, proud to be in a profession where, it gets so much respect. But one of the things that drives me crazy is I work the midnight shift, the graveyard shift, 6P to 6A. And I've worked this shift for many, many, many years. And this is happening to me here in my job currently in New Mexico. And it has happened to me in the past at other jobs I've had. And what it is usually around 1 or 2 o'clock in the morning, you get these nurses, and I have this one now who drives me crazy. She'll come into my office and she'll be like, "Oh, Dave, I'm just so bored." And she's done this many, many, many times over the past months. And finally, last night, she came into my office and she's like, "Oh, David, I'm just so bored." So I was like, "What do you mean bored?" And she was like, "Well, it's 2 o'clock in the morning and everybody's asleep and there's just nothing to do. I'm just bored." And I was like, there's something that I need to get off my chest. You're a nurse. Your job is to take care of people, to make sure that they're healthy and doing well. Who cares if you're bored? To me, I prefer to be bored. And what I mean by this is, if I go to work tonight and it's a boring night, that means nobody fell, nobody has a skin tear, nobody's having difficulty breathing, nobody's having chest pains, nobody's throwing up, nobody's running a fever. That's a good thing. I want people to be healthy. I don't want them to be sick where I'm having to run back and forth and being totally crazy and send them out to the hospital. And I don't understand these nurses out there who's like, "Oh, it's just so boring." Okay, if you're bored, go work in the ER. And you can see kids come in that have been severely injured in car wrecks. You can see people come in shot, people come in stabbed, people come in drug overdoses, people coming in having heart attacks, people coming in having strokes, people coming in burned in fires, people coming in drowned. Go work in the ER and leave me alone, because I'm tired of this bored crap. I don't want my patients to be sick just so that I can have something to do. Read a book, get an imagination, do your charting, do anything else. But don't wish for patients to be sick so you can be busy. That's one of the things. I hate these false, nurses out there that, they talk so much like they care. And then the other thing that I want to talk about is these nurses out here who care way too damn much. Okay, as nurses, we're supposed to care, but to a point. And what I mean by this is we're always supposed to be professionals. If I think of every patient as my mommy or my daddy or my granny or my grampy, then I can't do my job. Because I promise you, if you work in this field for more than a day, you're going to have patients that die. Death is a part of life. I know in our society we fear death, and it's just like death is so we got to keep it away from us. But in the nursing field, patients die all the time. It's normal. Death is a part of life. People don't realize that, you're born, you live, you die. I know they know that, but nobody ever really wants to face it. So, and the reason I bring this up is because years ago I was a supervisor at this position, at this job I had, and there was this one nurse who, she was overly attached to this one patient. And to the point where it was like getting kind of creepy. Like even on her days off, she would come up to the facility. So she was well aware that this patient had a wound on their foot. We were treating the wound. Okay, it was a Saturday. I was at work. I was the supervisor. She was off. She comes up there, and of course to visit her little friend, the patient. And I get one of the CNAs to tell me, hey Dave, so-and-so, the nurse that works here, she wants to talk to you. So I'm like, okay. So I walk down there, and not only is she in the room, but the family of this patient is in the room as well. So I'm like, yes, what's going on? And not the family, but this nurse, hear me, starts asking me about this wound on the patient's foot. And I look at her and I'm like, well, you work here. You are aware of what we're doing. And I said, beside the point, I said, I can't talk to you about this. This is a HIPAA violation. I said, this, has nothing to do with you. You're off today. You should be totally, away from this subject. You need to. And she got all mad and started raising hell. So I said, hey, you need to come with me right now. And at first she wouldn't come with me, but she realized, she seen the seriousness in my face. So she came with me, and I took her down to the nurses, to my office, and I shut the door, and I was like, you are crossing the line. And she's like, what are you talking about? And I'm like, that lady is not your family member. You are not on her people that we can share information with. This is a HIPAA violation. Number one, you're a nurse here. You can read the charts and everything, but I can't be talking to you about this stuff, And I said, and especially, I'm not going to talk to you about this stuff in front of the family. I said, if the family, and she's like, well, the family, I'm like, you're not the family. So I was like, you need to stay right here because I'm calling the administrator. So I called the administrator and I explained to her the situation, and she told me, fire her on the spot. I was like, are you serious? And she's like, yeah. She's like, fire her on the spot, walk her out and tell her not to come back. So I did. And she got all huffy, but I walked her out and she was gone. So not only do I not like this fake, like you care, but I don't like this unprofessional. These people are not your family members. Leave them alone. Be professional. The families respect nurses, and they want you to be honest with them and give you the truth about what's going on with their family member. They don't need you getting overly emotional and like crying, because that freaks them out. Because they look to you as a pillar of strength, and if you're freaking falling apart on the floor, it's going to freak them out, And like I said earlier, also you nurses out there that, oh, I'm bored. Well, those are the nurses that I would pay attention to, because they might be in there, pouring weird stuff in their patients' IVs or something like that, because they're just so bored they need something to do. So what I'm saying here, be happy that you're bored, because that means that your patients are doing well. That means that they're not sick. That means that the medication is working. The infection is going away. They're breathing. Their O2 stats are good. Their blood pressure is good. Their vital signs are stable. That's what you want. You don't want sick patients. If you want sick patients, go work in the ER. Go work in a step-down unit so you can have surgical tubes to mess with, and staples to mess with, and IVs and IV antibiotics to mess with. Go do that and have your patients in the, ICU, and you won't be bored. So screw all that crap. Just because you think you care doesn't mean you actually care. So, I know nursing is a respected position and a respected profession, but there's some nurses out there that got their heads screwed on wrong. You're a professional. You need to do your job professionally. You need to keep a professional separation, a boundary between you and your patients. And like I always say, they're not your mommy and they're not your granny. They're not your daddy. They're not your grampy. They come to you. They look up to you for the truth, for proper care, and for strength. And if you can't give them that, your butt needs to move on. So this is David, Zoe Zizzles. Thank you very much. Make sure to like and subscribe. Have a great day. Bye.